Aortitis is the inflammation of the aorta. Infectious etiologies are rare, but potentially life-threatening. In this case, we report on the unique clinical presentation of aortitis, developing from a chronic Pseudomonas infection and resulting in severe vascular complications. Case: a 63-year-old male with a 25-year history of paraplegia due to a motor vehicle accident and chronic sacral ulcer, presented with wound discharge, pyrexia, and rigors. The patient had a previous diagnosis of Pseudomonas osteomyelitis and bacteremia, effectively resolved through antibiotic therapy. Approximately 2 weeks later, the patient was readmitted due to profound fatigue, pallor, and hypotension. The patient had developed severe anemia, requiring emergency admission and immediate blood transfusion. CT scans revealed spinal abscesses and inflammation underlying the ulcerative sacral lesion. Regrettably, a biopsy resulted in hemorrhage and hemodynamic instability. Additional CT scans revealed signs of aortitis. Vascular surgery specialists were immediately consulted, and CT angiography confirmed rupture of the pseudoaneurysm and drainage into the surrounding abscesses. The patient promptly underwent an axillary femoral bypass procedure and received a 6-week course of meropenem antibiotics. Post-procedure stabilization was achieved. In this case, we present a distinctive clinical scenario of infectious aortitis complicated by aortic rupture. Bacteremic aortitis frequently leads to the development of a ruptured mycotic aneurysm. This is a highly lethal complication, particularly when surgical treatment is delayed. Furthermore, Pseudomonas is an infrequent pathogen affecting the blood vessels and is associated with a substantial mortality rate. For infected aneurysms involving the iliac arteries and the infrarenal aorta, an in situ graft interposition combined with omental wrapping represents a safe and effective revascularization option. Due to a timely diagnosis, prompt surgical intervention, and appropriate antibiotic therapy, this patient experienced a favorable outcome. In conclusion, this case illustrates the potential for severe vascular complications of chronic aortitis and the value of an early diagnosis and intervention in improving patient outcomes.